Hello.
Hello.
We are here.
Finally.
I was so nervous with this.
Yeah, same here. Yeah, I'm glad my account got reactivated again.
Yeah.
Yeah, it was really nerve-wracking.
Yeah.
Okay. So, let me see. Hi.
Hello.
Hello.
Hi.
Hello.
Great.
I also have a Red Cross t-shirt.
Yeah, I always do that.
I should really ask Carmen for that.
Yes.
They look nice on you guys.
Oh, okay. Let's wait for the others.
Yeah.
If you have any doubt about the platform, maybe you could ask me because I have already used it yesterday in live. But well, I think one thing important to know is that when hi. One thing important is that when we are going to end a session, all of us we have to get out the session, exit the session, because if we don't do that, the transmission continue.
Oh, okay.
Sorry,
we must
Milena,
exit.
I didn't catch it because I was putting on my headphones. Could you repeat the point you mentioned right now?
Sorry. Hi.
Hi, I'm Eve with Juno.
Hi, everyone.
Everyone doing well with their
Hello.
camera and mic?
Yay.
That yesterday, when we finished the session, we just turned off our cameras, and we believe that the transmission was over on YouTube. But they explained us that we have to exit the entire platform and the transmission finished.
Okay.
Mm-hmm. If we don't do that on YouTube, we're still on live.
Okay.
Hi, I'm Eve. I'm with
Everybody. Hi.
Hello.
Hi.
Is everyone doing well with their mics and camera?
Yeah, I think so.
I think so.
Yeah.
I'll just move this out of the way.
Great.
Just letting you know that Omnia told me that she will be a bit late joining right now, but she will be here on time because she was a bit stuck in traffic, but she's on her way.
Okay. Can we start the rehearsal to go on the agenda?
Yeah.
Yes.
So now let's just say that now we are live and we say hello, right? And then
Yes.
Christos, you say that you will be the moderator.
Yes, because we do not have a long time and it is quite late in the day. I think I would not do really big introductions, so I will just welcome everyone, read out the housekeeping rules for the session. Basically just mention one or two points about the objectives of this session, what it's going to be about, and start first. Mentimeter, I see that we have a question on what the mental health impacts of COVID-19 has been on people. So this can be like sent out to the participants so that they can start putting out the responses for that. And then one by one, I would start introducing all of you. I would suggest, I think it will be a bit easier at this point if each one of you mention some points about who you are, where you come from, your affiliations, and your work, and so on. Keeping it like to a minute and a half for personal introduction. And then we start the moderated discussion with all of us. We have the 2 questions. We have 3 minutes for each panelist on this. We can select based on the time. If there is time for someone to add something, you can let me know, like open your microphone or even send it over in the WhatsApp chat, whatever you prefer, that I would like to make a short intervention or a short addition into this point, and I will give you the floor. Oh, and also, I forgot to mention before that, it would be good before beginning the moderated discussion to take also a look at the Mentimeter, comment on the responses by the participants. Sorry, I didn't mention that. So yeah, the moderated discussion, and then we will have the questions from the audience. I will be reminding them to leave the questions throughout the session, either in the Q&A, also in YouTube, and they can be transferred back to us. And yeah, finally, we got 2 more questions on Mentimeter about online tools that the participants find helpful to support mental health, and how willing they would be to use online tools that support mental health. So I don't know, like, what you have prepared for your responses, but perhaps you could even send out questions to the participants and they can respond in the chat box, so it's a bit more interactive and from their side as well. But this is totally up to you. Yeah, about just a quick question about the first question of the discussion, which is, what is your organization and what are the digital efforts led by you and young members to address mental health? I just want to ask Ken if you would like me to rephrase that in any way for your case for WHO, or you could just make a comment at the beginning of your response.
Yeah, no, it's fine. I've got the sort of response I've got is partly about digital and partly about how we can support young people with their support with what they're doing.
Okay,
I do have a question. So I have some websites, some different WHO materials. How would I put those in the chat or on YouTube? How would I do that?
I think Eve, if you could tell us, so I don't make any mistake with that.
I think yeah. I'm sorry.
Yes.
Low.
Okay.
We have like 3 chats: chat, Q&A, and mod. Chat, it's for all people, all can see. So for example, we can put that, and people inside Juno could read that. But if we want YouTube people can see too, I think we could put a moderator and someone else could copy that on YouTube.
Ah, great. Okay, so I put it in the chat for everyone on Juno, and then I put it in moderator saying, please put on YouTube, and then they'll put it on YouTube. Brilliant. Thank you.
Sorry, my site was muted. I had to refresh my page.
That's totally okay.
I hope you're, did you have another question I can help you answer, or? Okay, great.
Just
Christos,
something from my side.
I have a doubt. We have just 3 minutes for 2 questions, so 3 minutes for each question. Or...
For each question, it's going to be 3 minutes. 3 minutes for each panelist to give it.
And you are inviting us to take the word?
Yes,
Andrea,
yes, I will be giving
Milena.
the floor. Yes, exactly. I just wanted to ask, if you could give me again the pronunciations of your name, so I don't make any big mistakes for that.
Mine is Andrea.
Andrea, okay,
how it's easier.
I keep it to first names because I think last names could be risky for me. So Andrea, Clarice, I imagine, Milena, and Ken, and Omnia, of course. I know Omnia. Great.
Okay, and then I have another question. So I have to share my screen for the Mentimeter, and we agreed that we will not have that question with "How are you feeling?"
Mm-hmm.
I will delete it, and we are starting directly how COVID-19 had impact.
Yes,
you.
exactly.
And the second question, would you use online tools that support mental health? And the choices of answers are yes, maybe, and no. And the last question is, what online tools do you find helpful to support your mental health?
Yes, exactly.
And then first we open the Mentimeter, and while the people are answering, we are presenting ourselves, or we are presenting ourselves and then we open the Mentimeter.
What I would suggest is that we send Mentimeter in the chat for the participants to and for everyone to join. There is a signal in my screen. I don't know. Can you hear me well?
Yes.
Okay, because it's the signal of Wi-Fi with a red over it, but I don't know. Anyway, yeah, what I would suggest is that we send the link for Mentimeter directly to the participants in the beginning before introductions, so that they have time, to connect into the platform, find the questions and all that. And while they are, I will tell them that you can start responding to this question. And while they're doing that, we can start with introductions of the panel.
Okay, we have chat, Q&A, and polls and mod. And on mod, we only see the ones who are facilitators, what we are talking. And I just posted the Menti link, Christos, if you can see it, and can you
Yes.
check if it's working?
Yes. I go directly. Question number 1, how COVID-19 pandemic affected your mental health? So I think it's working perfectly.
Okay.
Hey team, excuse me really quickly here. It's Juno. It's Joseph from Juno. I'm just checking in to make sure that first, are we finding our way through our session here, or is there any technical issues? Nope. Okay,
All
that's
going
good.
smoothly so far. Yeah.
That's good to hear. We'll keep it that way. Last thing is, are all of the speakers in this room, or do we still need to add some more?
We are waiting for one speaker. She has informed me that she will be a bit late for the preparation stage, but we'll expect her to join.
Has
She
she
has
logged
already
in?
delivered the session, so I don't think she will have any problem navigating.
Okay. Oh, she's
the
already
platform.
delivered the session before, you said.
Yes.
So we know that she are familiar with the platform. She has login and everything. Okay.
Exactly. Yes.
Sounds good. So if that's the case, then well, best of luck to you guys. Let us know if there's anything that comes up, and we'll get that situated for you guys.
Perfect. Thank you very much.
You're
Thank
welcome.
you.
Enjoy.
Thank you.
Let me just really quickly grab my charger.
There is something with when we share screens. Sometimes people where is that? Sometimes people said that the screen look very small. So I don't know. There is a way like people can expand the screen.
Yeah, you at the one of the meetings that we had said that we should encourage the participants to press that icon
Okay.
that it's look like
Okay.
two arrows.
Okay.
And Christos, when you are telling me to share the screen, I will share the Menti screen.
Yes.
And questions will be at the end. Questions from people.
Yes. I will tell them that they can send the questions throughout the session, but we will be addressing them at the end.
Okay. I have saw in some sessions that people make many questions, like many. So sometimes questions are not addressed. So that's something to try to figure out.
I've seen in some sessions they say that we can gather the questions and then send them over email if you have time. Like, I don't know. To me, it's easier if we're able, for example, to group them or to select the ones that have been upvoted the most in the Q&A, because you can upvote questions that you like. So
Yeah,
we do have limited time, and yeah, there's so much we can do.
Yeah, and maybe you can invite them also to, if they have like specifically questions for ourselves, to write us in private.
Yeah, we have our profiles here in Juno, so we can send messages to one
Yeah,
another. So
exactly.
yeah, it won't be a problem.
Clarice and
Yes.
Milena, you will, at the first question, what is your organization and what are the digital efforts led by you and young members to address mental health?
Mm.
What you are thinking to say? You will be talking the example that you have in your field or in general?
I'm talking about the examples like we have in Hong Kong. Yeah, so more like sharing what we have been doing in Hong Kong. Yeah. And then the second part would be like more my sharing of like what action they want we can do for like mental health support.
In my case, I was sharing about Mexican example and Costa Rican example of the two projects, psychosocial youth projects, like a regional representation. And I was explaining, I don't know if someone else is going to explain that in Red Cross, in the psychosocial area, we train people in first psychological aid, and that's the reason why people can do that. But I don't know if someone else is going to say that.
Okay,
So I don't
you can
repeat.
say it. Yeah, you can say it, and I can be Christos. I can be the last one between the three of us then.
Great.
Hey, can you hear me and see me well? Yes?
Hear you, not
all good.
see you.
You can't hear me right now?
Yeah, we
I can
can.
hear you
Yes.
perfectly.
Okay, perfect. Yes, perfect. Sorry for the delay. And good luck, everyone. I'm sure it's going to be amazing. I'm very excited to hear all your thoughts and efforts. And yeah, happy to see you all.
For the first question, for example, because it is focusing on efforts of organizations, would you like me to divide, the Red Cross responses, like go first with Milena, for example, then perhaps Ken, then Clarice, then Omnia and Andrea? Would that order work for you? Great. Oh, and Omnia, something that we discussed before you logged in. Basically, at the beginning, I will make a short introduction into the session, and we will be sending also the link to Mentimeter so that participants can start sending the responses for the first question. And while they're responding, I will ask each one of you to shortly introduce yourselves, your affiliation, and so on, and then begin with a short view of the responses from the participants and the moderated discussion.
Sounds perfect.
Great. And we've got 10 minutes to go until the session starts. So you can grab some water, stretch a bit. Milena is quite alert and ready. Perfect.
Other thing that we saw yesterday on YouTube transmission is that they are using caption, automatic caption. So if for any reason two people speak at the same time, caption became crazy because it's a machine, so it doesn't know how to work. But in our case, I think it's not going to be a problem because we have like an order.
in case, I would say that we keep our microphones closed if we're not speaking, unless you got an issue and it's difficult to open and close it and so on. For cameras, I don't know, like it's a personal preference to keep cameras open throughout the session, but it's totally okay. Like if you want to shut it off for a minute or two or whatever. So I will leave it up to you for that.
Okay.
Are all the speakers here? Okay, great. And everyone's doing well? Need any help with anything?
Yeah.
Okay, your sound is working too. Do you have any videos or anything like that? Okay.
No, just sharing screen for a Mentimeter.
Okay, great. Just wanted to check. I know sometimes for us with the audio, it's always good just to make sure that we can hear your videos as well. But if you're good, then that's something.
Yeah, I think we are a technically comfortable and convenient session.
That's so great.
Keep it simple.
I'm interested in this, so it's really fun to, talk to everyone who's all over the world right now at this event.
True.
But can we respond to the questions also in the chat?
Yeah, you can.
Okay.
Mm-hmm. Yeah, you can respond. I think you can do questions and answers. I think the polls, if you were going to do a polls, those would have already been set up already. Who's moderating? Is there anyone in here?
I'm the moderator.
Okay, yeah. So, if it's easier for you guys to respond to the chat than the speaker, go for it. Whatever you feel most comfortable with. And it's always great too. You can encourage everyone to use the emojis to respond just for some interaction. A lot of people like to put like where they are in the world, 'cause that's always fun to see. Yeah.
Yeah. For the questions from the participants, I would probably selecting like maximum 2 speakers to respond, for time time management. But the rest of you, like if you have points to add or anything, you can freely interact in the chat.
Yeah. Yeah, I think that's a really kind of the
Ken, if you're talking, you're muted because I see your lips moving, but we cannot hear you.
Yeah, Ken, you're muted. It could be your AirPods too, maybe. I'm not sure. 5 minutes. That would be great. I feel like also when you're on video, it kind of like loosens your mood a little bit, right?
I had this session like 45 minutes will just fly by.
Ken, can you hear us? You can hear us. We can't hear you. So you might have to refresh your screen. I know that happened to me going into the room, and you have to you have to make sure that you click video and audio. Our team actually just reset all of our settings, so this is new for us too. Okay, did you hit video and audio?
Work.
Okay, we have you.
Very good.
Yeah.
Right, I went off again.
Yeah. If that does happen to anyone, refresh your screen and then click join with video and audio. And then
Okay.
if you hit the exit button, that gives you the option to not be on camera, but stay in the session. And then you'll have to join again, but it'll keep you here. This is a new setting that was surprise on Juno, but we got it.
I was asking Eve, how many people do you have at the conference? How many people have attended?
I actually don't. We'd have to pull that data, but we will find out. At the end of it, we can pull all of that.
Very good.
Actually, the Global Youth Summit, they probably have the information based on registrations and emails and stuff like that. And also, it's a 3-day event, right? So they're probably going to want to see how many people attended on different days too. All right, you guys have 3 minutes. I'm going to go off camera. Everyone's okay? Ken, you're good?
Yep.
Yeah.
All right, great. And you guys are going to kill it. Have a great conference, okay?
Thank you.
Thank you very much.
Sorry, I will make one more comment. Christos, when you are taking a question from the public and it's like one in general, maybe we can have like a sign like this, like who wants to answer or has an idea, I don't know.
Whatever is easier for you, like you can open your microphone, and I will see that you have opened your microphone if you have kept it closed before. I don't know. Whatever you think would be easier for you. Or open your camera if you have it closed, so I know that you want to jump in at that point for that question. Okay, 2 minutes remaining. I'm actually looking now at the housekeeping rules. I hope I read them quickly so we don't lose too much time, with preparation stuff.
Oh, yes. I made it yesterday in Spanish, and I just make like a rephrase in 3 words because it's too many, so long, and it take a look at a long time. So. Also, people can put copy and paste on the chat. Is other thing that I have shown that other facilitators could be.
Mm-hmm.
Can I take a picture of us?
Oh, yeah, I think that's the best time to actually do it.
Yeah.
Ready? Someone else can take one too.
I'm curious to see if when the time comes, participants just jump in all at once.
I love when the emojis start to appear, all the hearts, and start and appear a lot.
It's actually quite a nice platform. It's the first time that I'm using it, and I really like the possibilities that it gives you.
Ten seconds.
Okay, I think we have just gone live. So welcome everyone joining our session on youth-led digital action for mental health. Christos. I am a young doctor from Greece, and I'm currently serving as the liaison officer for sexual and reproductive health and rights issues, including HIV and AIDS in the International Federation of Medical Students Associations. I will be the moderator for this session. Just to begin with, I will be going through really quickly some housekeeping rules so that we are all on the same page about how this session is going to go. So some of you might be joining through the Juno platform, and many more are joining through the live broadcast and multiple social media channels. A warm welcome to all of you. So a bit of housekeeping. Please note that this session is part of the Global Youth Summit, and we strongly encourage you to explore other sessions for the remainder of this day and also for tomorrow, the last day of the summit. By joining this session, everyone who will have the opportunity to speak consents to their images and audio being broadcast. By participating in the Global Youth Summit, you have agreed to behave respectfully and be culturally sensitive towards other people, to promote the principles of respect, diversity, and inclusion, as well as to actively prevent and not engage in abusive behavior of any kind that leads to any harm, prejudice, discrimination, or harassment against any person. If you do not adhere to these principles of Summit's Code of Conduct, you will be removed from the session and potentially banned from the entire event, and the organization that nominates you will be notified of your actions. We have a safeguarding team moderating our interaction on the Juno platform, the live broadcast chat function, and all social media channels. Finally, should you at any point feel unsafe or witness concerning behavior, please reach out by sending an email to saved@globalyouthmobilization.org. You may also get in touch with our support team at the virtual help desk, and all information emailed to the email address will be kept private and confidential. And having said that, I think it is time that we begin with our session. There have been a lot of sessions throughout this Global Youth Summit about the effects that COVID-19 has had, many riveting discussions on mental health. So I think this is a really good point for our session to come in and we start discussion about solutions that we can have for digital platforms. Before I introduce our great panel of speakers for today, I would just like to ask that a link is shared with you through the chat function of the platform for Mentimeter. There you will find an initial question that we would like to see from all of you answered about how the COVID-19 pandemic has affected your mental health. You can take some time to respond to this question through the Mentimeter app while our speakers introduce themselves. So first, I would like to begin with Ken. Ken, welcome to the session, and you can take some time to briefly introduce yourself and give us a bit of information about your background, and of course, greet all our participants.
Sure. Thank you, Christos. Yeah, so my name is Ken Carswell. I work at the World Health Organization, and I'm based at headquarters in Geneva, where I work in the Department of Mental Health and Substance Use, and I'm the focal point for digital and innovation in mental health there. So that's my role, and I'm looking forward to talking on this panel today. And thanks for the opportunity, because it's a very important and timely event. So thank you very much.
Thank you very much, Ken. Really happy to have you join us. I will now move on to Clarice. You can have the floor.
So hi, welcome everyone from all around the world. So my name is Clarice Tam. I'm from Hong Kong, and I'm a psychological first aider. I volunteered in the Hong Kong Red Cross branch of Red Cross Society of China. So I'm also a occupational therapist working in the mental health field. So I'm really very happy to be here and so thrilled to share my stories and my work in mental health.
Thank you very much, Clarice, also joining us at this late time for you. Thank you very much. Moving on now to the other side of the world, if I can say, Milena, you can introduce yourself.
Hi, everyone. I'm Milena, like Christos said, and I'm from Costa Rica. I have a master's degree in clinical psychology, and I have been volunteering in Red Cross and Red Crescent movement since 9 years ago. I'm really passionate about mental health and awareness, and that's it. Thank you so much.
Thank you very much, Milena. Before I go to our next speaker, just draw your attention to the chat box where the Mentimeter link has been set. You can start sharing your responses through this app. I will now go to Andrea.
Hello, everyone. Good evening, good morning. I'm Andrea Dumitroae. I'm from Romania, and I'm representing Red Cross. I'm a volunteer in Romanian Red Cross for 10 years, and I am involved in the mental health area for some years, and I'm also a medical student, so I'm very, very passionate about health and this special mental health. So I'm glad to be next to you in this session.
Mulțumesc, as you would say in Romania, Andrea. Thank you very much for being here with us tonight. And finally, to a really good friend of mine, I think we've been together all week. Omnia, you can also introduce yourself.
Yes, hi everyone. I'm Omnia Lomdoni. I'm a young doctor from Cairo, Egypt. IFMSA, I work with Christos. I'm currently the liaison officer for public health issues. So mainly the external focal point for IFMSA, representing the voices of medical students, specific issues related to non-communicable diseases, mental health, and climate change. And I lead our communications and partnerships with WHO, diverse UN agencies, as well as the World Federation for Mental Health. And I'm really happy to join you all today.
Thank you very much, also Omnia. Just before we begin, like with the main section of our discussion, just to remind you that you can leave your questions or your comments throughout the session at the chat box or the Q&A, also in YouTube, and everything will be, or as many questions as possible, will be addressed at the end of the session. So now, I think we could take a minute or two to look at some of the responses that we have had in the question in Mentimeter about the effects that COVID-19 has had on the mental health of our participants, and see if there are any striking outcomes that we can draw based on these responses. So we will be seeing, yes, Andrea's screen. So we see here about increased screen time, very poor effect on mental health, negatively monotony of everyday stress, online school, increased anxiety, more time for self-reflection as well. This is quite interesting. All days feel the same, lack of social interactions, loneliness, Zoom fatigue, anxiety. So I feel that the overwhelming response from our audience is that most of the effects have been on the negative side of things on the spectrum here. Zoom fatigue, which one of us hasn't experienced that, really? So I think we received many really interesting responses into that. It is quite true that COVID-19 has had a really negative effect on a lot of people globally on mental health. So I would like to begin a discussion, and I would like to ask first Milena, what is your organization? What are the digital efforts led by you and young members to address mental health?
Hi, everyone. Like I said, I'm Milena, and I'm a clinical psychologist. And in 10 years that I have been working with people, I have never felt frustrated and exhausted like last year. To me, it was a very hard year, like all the years. But one thing that kept me motivated to continue doing my job is my volunteering at Red Cross. What we do in Red Cross in psychosocial area, we train people in first psychological aid, people that doesn't know anything about health or need studies in university, people from communities, young from high school, in first psychological aids, in the same way to physical first aid. And these people can make interventions. So for example, here at the Americas, I want to share two experiences from Mexico and Costa Rica, two experiences created by young people using technologies. First one, it's in Mexico. They create a hashtag that in Spanish is necesito un Juve amigo, and in English is I need a Red Cross friend. So people put the hashtag on their walls, media walls, and when someone else that is trained look this hashtag, connect the people and contact the people, asking why they need, how they feel, and in this way they have already attend by week 4 cases, and they have already referred 6 cases to professional mental health because people have other kind of situations that require more intervention. That's something simple, easy to do, and everyone else if we are trained. Second example came from Costa Rica. 2 young people with 16 and 17 years old create an intervention by WhatsApp. So they create a text saying, hi, Andrea and Milena, I'm a psychosocial volunteer, and I want to know how are you during this pandemic. That was last year when everyone else didn't know what happened. So that was from the capital city here in Costa Rica, San Jose, and they have already attended 60 young volunteers, just 2 people, 60 young volunteers. It was very exhausted, in fact. Also, they follow up, 15 volunteers require follow up, and 2 volunteers were referred to professional mental health. This project was so successful that we replied the same project in other regions, and right now we are executing in a coast region called Punta Arenas, and we just require. It was simple, easy, important. They require also self-care because it's very hard to listen and read people every day saying, I'm tired, I'm exhausted, I'm sad, I don't know what to do, I want to go out, because it's the same thing that we feel. So that are 2 examples of how we can use technologies to promote mental health, because I am a professional in mental health. I think that more the better, and big problems require big solutions, and we can be part of them. So that's my example. Thank you so much.
Thank you, Milena. We really saw right from the beginning, like the power of quite simple stuff, or there a hashtag or a WhatsApp platform, what they can offer for us. Now moving on to a different level, more technical perhaps. And Ken, we would like to hear your perspective also from the WHO side about this question.
Sure, thank you. So, so really, I'd say that a lot of our work at WHO is to support mental health globally, and really, it's about giving the tools to others to help them to support mental health, including initiatives by young people and different approaches. Now, in the next question, I'll probably talk a bit more specifically about some of the interventions and some of the actual tools and packages that are available. But now, in terms of our work more generally. So we do a lot of work to develop recommendations about the type of care and support that people with mental, neurological and substance use conditions should receive. And we've also been doing a lot of work more recently with digital. So I'd say that in the last year, we've seen a massive change in terms of the amount of support that's being provided digitally. We see, a big move to giving online consultations, a big move towards online self-help, tools packages, some of the examples there. And at WHO, we've also been working on this. So for a number of years, we've been developing evidence-based self-help tools. So self-help is like an app or a book that somebody can use to learn the types of techniques they need to reduce stress, or to techniques that might help with depression. And one example of that is that we developed an app called Step by Step with the National Mental Health Program in Lebanon and other partners. And we tested it in big research trials. And now we've completed those research trials. So now that intervention is now being scaled up throughout Lebanon. So we take an approach where we involve a lot of users, a lot of young people, a lot of users in the development of these aspects. And we also test them to make sure they're evidence-based before we release them, and then hopefully give people the tools to sort of scale them up. I mean, in terms of other sort of digital work that we're doing in our department, we've also integrated into the WHO Health Alert chatbot, which is a chatbot you can get through Messenger and through WhatsApp, and there's a small stress management package and techniques in there. So that's something else we've been doing. And finally, we're also working to develop a chatbot for adolescents and young adults to help with emotional distress. And then we did some formative work with that, where we involved around 250 adolescents from different countries around the world. And we're now looking to develop that further and then look to test it in randomized controlled trials before releasing. So we've been doing quite a lot of work in digital, and we see a lot of value in digital approaches for supporting mental health. But it's also important to sort of try and remember that these are best integrated within a system and within the other approaches like we're hearing about here, where people can access different types of services, different types of support, with digital being one aspect of that. But it's certainly very exciting to hear the types of the things that have happened in the last year, and to hear some of the examples we're going to hear today as well. Thank you.
Thank you very much, Ken. I think already from the first 2 responses, we can draw some lines. For example, you both mentioned self-care. So I think I'm predicting that this will be a crucial concept for our discussion in this session. But now moving on to Clarice, also to hear from your side about your organization and the actions that you have taken on this issue.
Yes, hello everyone. So just now I'll talk about like I'm a first aider, a psychological first aider for Red Cross. So in the past few years, the youth in Hong Kong or around the world experience stressful events like social unrest and the COVID-19, and on top of the daily hassles they encountered every day. And so Hong Kong Red Cross, the branch of Red Cross Society of China, established a project called Journey Together in 2020 and aimed at training youth workers with knowledge and skills in providing psychological support to the youth. So what they've been doing that, and they know that youth are captivated by social media and interactive games. So the Red Cross developed teaching kids like with the use of YouTube videos, clips, and Instagram channels to connect and engage the youth in an interactive way. So for example, in YouTube series, the viewer can experience a day of a youth and the various stressful daily hassles they have, like for example, preparing for exams, having a fight with their partner, and being there for a friend who just broke up. And the viewers get to choose how the story goes, and the storyline actually leads to different endings. And ultimately, just what Melina and Ken said, it promotes importance of self-care. Like we need to take care of ourselves before taking care of others and going on a journey more over and over. So and then Red Cross also created another like choose your own adventure game on Instagram for teenagers to learn how to be aware of symptoms of mood disorder. So for example, let me ask you here. So what would be your choice when you see your friend or your crush being sad, unmotivated, and lack of appetite? And will you go like avoid talking about it, or you will go ask your crush, what happened? Do you want to talk more? And throughout this interesting game and story, there are many like psychological information on depression, like how to support your friend when they're upset, and disputing some myth like they are being lazy because they are unmotivated. So there are more like psychoeducational information on that. And additional to the Journey Together project, they also have a 3 minutes online mental health test, allowing young people to check in their mental health status and seek help if needed. So if you guys want to do it afterwards, you can all try. I think it's in Chinese, yes. And there is great information at the end of the test so that user can understand the meaning behind the scores. And information from the local psychological support service, Shall We Talk, which is handled by trained volunteers and staff members, is provided in the test as well. So I think all these projects are going to engage the youth again because of the this engagement throughout the COVID-19 and the anxiety level that spiked up because of COVID-19. Yeah, so this is what Hong Kong Red Cross have been doing.
Thank you very much, Clarice, giving examples from real life situations like seeing your crush being shot. So I think this definitely reflects with a lot of our audience being on the younger side of age. Now moving on to Omnia to hear from IFMSA's side about the actions being taken in this regard.
Thank you so much. And I've been really inspired already by all the activities that were done around the world from Asia Pacific to the Americas, which is really amazing. And from IFMSA's side, as an organization based in over 140 countries, and mental health has been one of the main global health priorities that we have advocated for and focused on. The way that we work around mental health in IFMSA is through 3 different ways. First one is through capacity building, the second is through advocacy, and finally by reflecting on the mental health of our members and ourselves working in the advocacy space. So first of all, when it comes to capacity building, IFMSA has been conducting diverse workshops that really aim to equip medical students who will be the first line responders and who should also think about not just the physical health of their patients, but also the mental health of their patients, as well as building the resilience of their communities. And to provide them with the skills, we have conducted a series of workshops. One of them has been the Mental Health Essentials workshops, which is really aimed at our members to learn, as Melina mentioned, the psychosocial first aid, as well as to be able to empower their own communities and the public with these skills to respond to the mental health implications that they see on a daily basis. And at the same time, we also saw the need for such capacity building efforts during COVID-19 when we did a survey that had respondents from over 100 young people around the world. And 58% of them expressed feelings of negative implications related to COVID, and primarily information that has been outbreaking related to the pandemic. And youth are exposed on a daily basis to social media and diverse outlets that really impacted their mental health, sorry. And we have seen, because of this, over medical students in over 30 countries around the world during COVID, just this period, do a lot of awareness and capacity building in their own countries, in their own languages, as well as highlighting the mental health implications and providing their members, either students as well as community individuals, with coping mechanisms that were really useful for them to handle the COVID-19 impacts. But then on an advocacy side, we have been collaborating with WHO as well as the UN Youth Envoy Office, and we did a series of webinars called Coping with COVID. And what was really unique about these webinars is that we had young people join these webinars as speakers and share their own needs and the impact that they have felt during COVID-19. And at the same time, we had very interesting experts coming, either meditation experts and yoga experts, come and give youth a fresh new mechanisms to use in order to cope with the impacts of being in the lockdown for so long around the world. We also really highlighted the importance of how the mental health of medical students as well as young healthcare professionals who were fast-tracked during the pandemic to work and at the front line, and we really highlighted and shared the impacts that they have felt and how their mental health was affected and how their physical health was also affected, but not really touched upon because of the other priorities that COVID focused on. And then the final pillar that we worked on, which was Mental Health Watch. This means that we did regular assessments of our own members who were working on a voluntary basis to assess how they dealt and how their mental health was when working on a voluntary basis, either in their own countries or on a global level within IFMSA. And we always did that either during the conferences organized, during the sessions that we had, or even the normal activities that they did. So we also wanted to safeguard their own mental health while doing so much of the volunteering work that many of us are doing. And I cannot end what IFMSA has been doing without just giving examples of what our members have been doing on a country level. So one of the really interesting activities that I've seen, for example, our medical students in India, they did this platform where medical students and members in their own community would sketch out the feelings that they had. So not necessarily just put into words, but they would submit their own drawings, their own doodles on how they felt, and they had the hashtag sketch it out. While on the other side of the world in Canada, our medical students realized that suicide was the number one leading cause of disability, especially in adolescents. So they did a series of educational programs that aimed at the students in high schools, and they worked with the teachers as well as the students to really add on and integrate knowledge related to mental health in the educational programs of these high schools. And then finally, I'd like to end my intervention with the activity done by medical students in Australia, where they created a platform. It's called the Human of Medicine, where medical students had the opportunity to submit stories, personal stories of the mental health effects and impacts that they felt. So it's kind of a platform for them. And at the same time, the resources as well as places where they can go that can provide them with the mental health care services that they needed. So yeah, happy to engage further in the discussion.
Thank you very much, Omnia. And let me just tell you, I see the chat box in the Q&A section literally blown away with the amount of questions and resources set. So this is really quite exciting for all of us to see. Finishing up this first round of discussion with Andrea for your perspective.
Thank you, Christos. I can say, and I would like to talk about an initiative that was born in the Europe region, where I am involved as a volunteer. The European Youth Network of the Red Cross and Red Crescent volunteers. It came an initiative that we call the Tea Party for volunteers. What is this Tea Party and how it appeared? It appeared on the need of the volunteers to stay healthy with the mind. I mean, in the pandemic, when we were blocked in our houses and so on, it was a hard period for all of us. And knowing the community of the volunteers from Europe, and knowing that they are also involved in COVID activities on the field, not being burnout, we as a committee that is taking care of the network, we think about something that may help the volunteers, and it came this idea of this tea party. What is a tea party? Was a meeting that we were holding each week and then monthly for volunteers, and to help them to talk and to be together in these hard times. And the rules that were set that we will not talk about COVID, and we were talking about something that helps us to feel better, like childhood games, favorite movie, fun things to do at home, just to help them to reduce the stress during the day, and to know that we are all together in this, and everybody is doing their best job in their community. And I just read a question that was asking how we are using social media in our advantage. It's something that we did with Zoom, because these meetings were taken place on Zoom. So we were gathering together and spending 1 hour, 1 hour and a half, and also socializing and see how we are doing together. So it wasn't something very difficult. You can try this method of the tea party on WhatsApp or on a Facebook group. So it's up to you to make the best out of social media.
Andrea, and thank you everyone for really thought-provoking and interesting inputs into this first round of discussion. I will really quickly go to the second question for all our panelists, and I would kindly ask that you perhaps give your intervention a tad shorter so that we have sufficient time also at the end to receive questions from the audience that I see we are receiving numerous questions. So the next question would be, what are 2 concrete actions that young people can do to contribute to the prioritization and provision of online mental health support? And perhaps I start this round with Clarice.
Yes. So I would say 3 S: speak up, share, and support. I think speak up is very important in mental health. Like, talking about mental health may be a taboo in your country, but it is not, and it should not be a taboo. And we have good days and bad days, and we can always talk about our mental health, just like how we talk about our physical health. And we can always ask for help and support from our friends, and even from online mental health support or platforms. And I believe that we young people have a loud voice and to share what we value, and people will hear what we want to talk about. So I would suggest everyone today, so just simply share a post on social media, like share the information you received from us today, and share what you have learned and your thoughts. And if one youth from each nation or country starts speaking up and sharing views on mental health, I think more young people will join in. And just like a ripple effect, people will start to be aware of mental health and support each other. And lastly, support your peers and the young people. Equip with yourself with basic mental health knowledge and skills from the training from your local Red Cross, and maybe like psychological first aid information, and be a good Samaritan to help your friends and when they're struggling. Like even as simple as like sitting next to your friend, offering a cup of tea, being by the side could mean a lot to your friends. Yeah, so we together can make this world a better and loving place.
Thank you very, very much, Clarice, for your recommendations. We can now go over to Ken to hear your thoughts on these actions that we could take.
Yeah, thank you very much. So I'd say probably the first action, well, the very first action is to look after your own mental health and the mental health of others around you. Things like social support, connection, activity, community, these quite basic things are key to good mental health. But really the first sort of action I'd say is contribute. I mean, it's wonderful to see so many and hear about so many young people doing excellent things in mental health. And I'd say find ways to contribute. That can be through volunteering, advocacy, could be about increasing awareness in your workplace or your place of study, or even just in your own personal relationships. There's many ways that all of us can support mental health and reduce the stigma that's sometimes associated with it. And the other action I'd say, have a look at some of the materials we've got on the WHO website. I'll very briefly go through a couple of them now, but I'll put them in the chat. There's a stress management guide that we published called Doing What Matters in Times of Stress. And I really would encourage everybody who's watching to have a look at that. It's available in 13 languages. We also have a couple of web pages, one that's aimed at resources for the public, which again has quite a lot of helpful materials about COVID and other things, and another web page that's related to materials related to COVID-19 and supporting people with that. Then there's a range of other materials we have about increasing human rights focused care, prevention of resources to support prevention of suicide for community groups, for teachers, for all sorts of organizations. So yeah, I hope some of these materials will be helpful for people in your work in supporting others. So I'll thank you, and I'll just put those in the chat to save us a bit of time. Thank you.
Thank you very much, Ken. I think it would be the best option to also include the links in the chat box. I can already imagine participants asking for the links. We can go over now to Andrea to hear your recommendations on concrete actions that young people can take for mental health support.
Thank you. I agree with all what Clarice and Ken said before me, so I will not repeat. But also to encourage people to allow themselves to be not feeling that well in one day, and to give us time, and to know how to listen to our soul. It's all right to be tired. We can't be 100% in every day. So be gentle with you. It will be my first advice. And sometimes we don't need big steps to change the world or big initiatives. It's like simple gestures, like a question, or how are you, or I'm not feeling okay with me, and it's okay. So and see what is not doing well to you and eliminate that factor, and yeah, be more present with you and see what it works for you and what doesn't work for you.
Thank you, Andrea. And let me just tell you, as a person that I think likes his work a bit too much, I think your recommendations are quite good, like to take it a bit easier sometimes. Thank you. And we can now go over to Milena to hear your thoughts on this.
Thank you. And at the same time, I want to answer one question about how teenagers can obtain skills to give first psychological aid. I'm a clinical psychologist. I have been for 10 years training people in first psychological aid. I train people from 15 years and above. So if you are 15 years old, you could do it. Why? Because teenagers talk each other. At the end, we talk each other about our problems. And I prefer a teenager have the training that doesn't have, so it's better. What do you need? You just need be interested. Do you need be capable to listen? You need be capable to understand when something is bigger and you need to ask for help, bigger help, like a professional. For example, if you are in high school and a friend tell you something, and if you believe that's something that put his life in risk, you must contact someone else, and that person not gonna get angry. At the end, that's a myth. For example, 2, if you are interested, for example, in this summit, you can continue looking for other initiatives, other organizations. We have already shared a lot of links, and I think that's a lot of time to studying. And the third more important thing is, if you have a question, do it. And fourth, if in this session there is any other colleague, there is any other young professional psychology, please put yourself to the service for the community, for the churches, for the high school, and give the training. We need more people talking about mental health because we are really tired too, and we can do it alone. Thank you so much.
Anna, and we can now go to Omnia to share your thoughts. Oh, you're muted, Omnia.
Now?
Yes.
Yes. Okay. So yeah, I totally agree with all that has been said, and I just want to give a different kind of perspective, which is more related to policy making and the voices of young people, because I see that there are so many efforts that are happening by young people, but we also don't want to keep doing this on our own. We also want our governments to work with us, civil society organizations to involve us and include our voices, as well as working with WHO, and not just on a global level, but also on a country level. And I see that as young people, we do a lot of activities, but what we're missing is that we hear the needs of our communities as young people, and we would love to see these needs reflected in the policies and the frameworks that are being developed for mental health. We're providing young people with mental health tools and coping strategies, but we also see how young people need mental health services that are youth-friendly, that are available, affordable, that are non-discriminatory, and that are accessible for us, because there are many young people out there that are also offline and will not be able to access the online mental health support that we are providing them. So we need to have more investments and more prioritization in these services, and we don't want our governments to handle them. We want them to co-create these services with us, because as young people, and that what I've seen, that we have a lot of experience, we have a lot of passion and innovation for what we do, and we would like to bring in this passion at the table with the governments and with the policymakers, and together create the services that the young people are needing. So that's my thoughts.
Thank you, everyone. I think you've provided really practical solutions and recommendations that a lot of us can really get inspired from and actually implement in our everyday lives. So I think on very different levels. So I think this is a really good outcome of this session. Moving now to the final part, if I could ask that the Mentimeter link is set once more, because we have 2 more questions that we would like to hear from the participants about. And I will also be checking the Q&A section and other questions set in the chat, because we have received so many really interesting questions from the participants that honestly it's quite hard selecting just 1 or 2 to get back to. I will select one that has been upvoted quite a lot, and this is it is the following. So what do you think is the best approach to do in order for those who come from low-income households and even rural areas to receive the best level of the mental health services in their community? This is addressed to all panelists. So if any one of you could this question, please go ahead.
We'd like to explain. Here in the Americas, we have the same situation. We have a lot of inequalities. People can't afford pay private services, and even we have, in some cases, Social Security. It's not available for everyone. So first of all, we need community services in schools, in churches. Like I said, if people are trained, at least he will receive the first service. If that first service is well received, it's easier to refer to professional services. That's the first one. Second one, people can make projects and look for funds, for example, with companies, local companies that want to help their own communities. In this way, you could say my project will be train people for fair psychological aid, and everyone going to love it. Believe me, everyone going to love it because it's something innovative. And third one, we need to use different ways. For example, I use a lot the phone because there is many people doesn't have internet, so that phone, normal phone. And in other cases, we have to use community visits, so we need a car to get into the houses. The key point to me is psychology and mental health must be outside the clinics, outside the hospitals, and must be on communities, in the house of people, and in the living rooms, and even on a computer. Because at the end, everyone needs some point of necessity to attend, and depends of the person, we could try to make a more creative service. Thank you.
Thank you, Milena, very much for your response. As we said, we have the next question up in Menti that we can really quickly take a look at the responses and get back to our panel after that. So the question was, if you would use online tools to support your mental health. And we see here that most of you have said yes, one maybe, no, no's for now, but you can take some time to also give your responses. I think, Ken, you also wanted to comment on the question that Milena responded to.
Yeah, no, just a very brief comment. Completely support everything Milena's saying there. And what I'd add to that really is that I think there's also big aspects about strengthening health services generally. So, and strengthening mental health services. And I think that's where also young people can play a role in terms of advocacy and strengthening that. But one thing that we know is that things like psychological interventions delivered by non-specialists are evidence-based. They're effective. We've got many manuals out there. We've produced a few at WHO where people who are briefly trained and then supervised can deliver such interventions, because we're never going to have enough specialists to do this work, but there are very effective ways of doing it. It's just really about finding ways to get these set up in different countries, and through sort of creative means, and through financing, and through a stronger sort of health system as well. So yeah, just wanted to add that.
Perfect. Thank you very much, Ken. And finally, again, getting back to our audience, we have gone on to the last question in our Mentimeter. So we need to hear from you. What online tools do you find helpful to support your mental health? And also perhaps this could be a good opportunity also to hear from our speakers. If you yourselves actually use applications or platforms or digital solutions to support your mental health, even before COVID-19 or during the pandemic or even now. I don't know if any one of you has something that they would like to share. Yeah, Andrea, and then Omnia can also share.
I have an application on my mobile which is tracking how time I'm spending on my phone, but also another application when I'm setting it not to use my phone, and it doesn't allow me. It's like growing plants, and if I'm using my phone, my plants will die or they will not grow. So it's a fun thing just to stay away from my phone.
Perfect. And Omnia, we can also hear from you.
Yeah, I just wanted to share that I was recently introduced to a really interesting meditation app. And it has very short meditation exercises that are really not time consuming, like it's just for 1 minute or 5 minutes. And it's really helpful to do it right before sleeping. I also find journaling very helpful, to just write down how I feel every night. Whenever I have the time, it only takes also like 5 minutes, and there are many applications that can be easily done. You can just write out even in the notes of your mobile phone, but I find this also very useful. Yeah, I will share them on the chat.
Perfect. Thank you very much. You can also see some of the solutions and the tools that our participants are using. Social media are quite big, so we can also see like positive side of them. But we have now reached the end of our session, and I would like to thank all of our speakers, Ken, Andrea, Clarice, Milena, and Omnia, for joining us and sharing your thoughts and your opinions today. And of course, all of our participants, we do hope that you were inspired and you received good ideas that you could use on. So thank you very much all for joining, and we hope that you enjoy your day and the rest of the summit. Thank you all.